Dr. Jacqueline Chassie, Vice President of Medical Education at Emerson Ecologics, and I'm really grateful to be sitting here today talking with Dr. Ann Haiden.
Thank you.
Welcome. Thanks for spending the time.
Happy to be here.
So just to start, can you tell us a little bit about what led you to integrative medicine? So you're an osteopathic doctor?
Yes.
By training.
Yes.
How did you make the jump from what most osteopathic doctors are doing today into more of an integrative practice?
Well, to go back even further than that, I started out my career as a graphic designer. And
wow.
Yeah, and then I got breast cancer. I was 27, I got breast cancer, got treatment for that, and it was a familial thing. So I got treatment for that, and I went on my way, but decided that I thought that being a graphic designer was too frivolous, not serious enough. So I decided to go back to medical school. So I had to pick up some courses and ended up at medical school. Went on my way after that, and then after about a 10-year break, got breast cancer again. So during residency, I got breast cancer again, and then again, I went through my treatments. I was still very much in the conventional mode. About 5 or 6 years later, I got really ill. Lots of different weird symptoms, which is part of what we're talking about today. And nobody had an answer. Nobody had an answer, and I had to figure it out myself, and I kind of muddled through until I fell upon functional medicine. So once I learned about functional medicine, things that I was working on by myself to figure myself out started to click, and then I started to look for root causes, and eventually left the place where I was and started my own functional medicine practice. So it was my personal journey, kind of by necessity.
Wow, thank you for sharing that.
Yeah.
I mean, it's so interesting how, like, a lot of times it is that kind of that personal road that you're trying to do the research, and with a medical background you had this extensive knowledge base already to kind of learn some new tools, and we're glad you're here.
But it's funny how that traditional knowledge base didn't get me there. I figured out pieces of it, but it was really revealing to hear that there was a different way, and now I can't go back to that old way. It doesn't make sense to me.
It is. You get that paradigm shift where you say, why wouldn't you do it this way? This is the way that makes sense.
That's right.
Yeah, funny. Great. Well, we're going to talk today about allergies, but not just allergies, really allergic symptoms, and we label them as allergies, but what's really happening behind that functionally.
Yeah.
So can you talk a little bit about how you view allergic symptoms clinically?
So when I think of allergic symptoms, I think obviously of the hay fever, the itchy eyes, the runny nose, maybe some rashes periodically, those kinds of seasonal things. That's the classic way of looking at allergies. Occasionally somebody will have a true food allergy. But a lot of times, people are frustrated. They go to the doctor and they say, I'm having food allergies. And the doctor says, no, you don't have food allergies, because they don't have an IgE food allergy. So the thing I learned, partly from my own experience and partly through the experience I see through my patients, is that you have to have a broader view of allergy, in that do you have flushing when you eat? Do you have mood problems? Do you eat and then have a high heart rate, tachycardia? Or do you eat and your blood pressure plummets? Those are all connected to this allergy idea. And the thing about allergies is, I think when we think about allergies, we're thinking about histamine. And I think that can potentially be just the tip of the iceberg. And what's underneath can be really mast cell triggering, something called mast cells that produce histamine that gives that allergy response. So you have to think of it bigger.
Okay, yeah, because a lot of the symptoms are caused by histamine in the bloodstream, correct?
Right, but when you start to think about it bigger, you can see that there's like 200 things in the bloodstream.
Okay, can you talk a little bit more about that? So is this due to activation of mast cells still, but they're releasing a lot more compounds that are having these effects in the body?
Yes, I think so. The thing that's confusing, that gives people mystery symptoms, is the potential of all these different mediators. They're called mediators. So mast cells are just part of your immune system, and that's how I think of them. Mast cells make and hold and then release 200-ish chemicals, which are called mediators. One of those, only one of those, is histamine. So you've also got tryptase, which is kind of the classic mast cell marker, but you've got prostaglandins, you've got leukotriene, so people with asthma might use a leukotriene inhibitor, for instance. And what they may be having is really a mast cell allergic type asthma. So when you think about allergies triggering any allergen, including classic allergens, or which stress can be a trigger. Many things can be a trigger. We can talk about that a little bit more, but you get a trigger, it activates the mast cells, and then any one of these 200 mediators, including histamine, can be kicked out into the system. And then you get whatever symptom goes with that mediator.
Okay. So Dr. Haiden, can you talk a little bit about mast cells? And they obviously do more than just release histamine.
Yeah.
They release a variety of compounds and in response to a lot of different triggers. Can you just talk a little bit more about mast cells and help us really understand their function a bit better?
Sure. So mast cells I like to think of as just part of the immune system, because they are. They're actually early responders, so they're kind of first responders. They can be triggered by many things. Their job is to produce and then hold and then release these triggers. So they're kind of pre-made, ready to release, and so a trigger comes along and they release them. There's like 200 triggers, so they can produce, theoretically, 200 symptoms. Only one of them is histamine related.
Okay. So what are some of the triggers that cause mast cells to release histamine and all these other mediators?
It could be anything. So it can be, they have IgE receptors on them. So it can be anything IgE allergy related. So when you test for food allergies in the IgE realm, that's what you're getting. But it could be stress, it can be lipopolysaccharide, it can be gliadins, it can be gut microbiota, it can be stress. So the mast cells actually have receptors in a way for stress, because they have receptors for corticotropin type releasing factor and hormones.
Wow, so that really opens things up for patients with allergic symptoms, because classically we think about it as being an immune system dysfunction, like a hyperactive immune system. But really what I'm hearing is that the immune system could be doing its job perfectly, in perfect balance, but really the issue is that other parts of your body are producing triggers for it.
Parts of your body, parts of the environment, anything.
External,
chemical,
internal.
Sure. And when you talk about mast cells, there's a spectrum, So everything lumped together is called mast cell disease. At the almost never seen is mastocytosis, which is the classic. And we used to only think about mast cells in concert with mastocytosis. But almost nobody has that has a gene. And then as you go down to the more common, you'll see conditions that still have genes, but it might switch from DNA genes to RNA genes that are somatic and acquired. And then you have this huge group of people that have secondary mast cell activation syndrome, where you see the triggers and no gene. I like to think of it even further as simply some people having mast cell overactivation, which really goes nicely with the trigger thought process.
Yeah, that makes a lot of sense, like from a functional perspective. That's what's happening regardless of what's triggering.
Right, so some people will have triggering. If you have a gene, they're kind of doing their own thing. So you can still address triggers, but it's not going to be as useful.
Right, that makes a lot of sense. So when it comes to mast cell overactivation, what are the most common triggers that you see in your patients over and over again?
Oh, I would say that there's just a couple.
Okay.
Even though stress is involved, it's not necessarily the main thing. I think by far it's the gut.
Okay.
Gut, I think, is the biggest thing. A lot of triggers, I think, are coming from environment. People are surrounded with scents and chemicals, and we don't live in a very clean world anymore, obviously. So those are all things that our body perceives as something that has to be surveyed for and attacked and gotten rid of.
Yeah. So really those outside pollutants that we're exposed to, or what you're talking about, that can really have a negative impact there. So avoidance of those is likely a really important part of a treatment plan. Stress management.
Yes.
You know, because it sounds like in this situation, like many others, stress becomes a predisposing factor because it kind of weakens our ability to adapt, right?
And it can participate in the vicious circle.
Okay.
So one thing that I see happen is people come in, this whole condition, it's funny to think of mood as an allergen, you know? But because of the way the mast cells work, different areas, the brain, mast cells are in all areas of the brain. So they're, for instance, in the limbic system, which of course has to do with emotion and fear and all those things. And so it's interesting when you look at mastocytosis, which is again the genetic thing, and that's where a lot of the studies have been done. They do studies on, it's like 33% with neuropsychiatric conditions in people who have mastocytosis. So there's this recurring theme of depression and anxiety and these types of things. So it's easy to say just reduce your stress, but if you don't reduce those other stressors we talked about, they can't reduce their stress because stress triggers the mast cells, but then mast cells actually go back and trigger stress. So you have to be doing many things at one time.
Yeah. What are the key ways that you work with your patients when it comes to stress, when this is an issue for them? Are there, is it therapeutic from, your like adaptogenic herbs, or is it behavioral? What are the things that you find to be most effective?
I had a patient just recently, and this is an interesting case. And I'll just use this as an example. She came in because she thought she was in the midst of a nervous breakdown. But it made her think that something else, that wasn't the whole thing, because there were these various other things. And to her, intrinsically, she thought something was going wrong somewhere that was making sense of that. And she had tried antidepressants and anti-anxiety medicines, and it was never helpful. But now she couldn't even leave the house, because of social anxiety. And she had a lot of stressors. Some of them were environmental, and they were renovating a house, and so they had to live in a small apartment. They were having to eat out, and she admitted, when I asked her, every time she ate for the last year, she had flushing of her face and her chest. And she had, gut symptoms. So taking all those things together, we were able to, we did a breath test and some stool testing, and she didn't have horrible overgrowth, but she had some symptoms there. Interestingly, mast cell and histamine release symptoms can kind of mimic IBS. So if you get abdominal pain and cramping and gassiness and GERD and diarrhea, you might actually be looking at histamine release.
Well, I didn't know that.
Yeah. So, or you could have some of both, which is more what I see. Anyway, her tryptase, that mast cell specific thing, came back 2 times normal, and her histamine was just borderline high. And we did the genes, she was negative. So, when we put her on some quercetin to calm down her mast cells, some DAO enzyme to help clear her histamines, got her on as best as she could do, eating out at restaurants, an anti-inflammatory diet, low histamine, low mast cell producing. She was able to clear her mental symptoms. So that's really interesting. She said, the first time in forever, I feel kind of normal. The only thing I have is situational stress, because I have some situational stress.
What a great case.
That's interesting. People would never think that by addressing, the mast cells, and we did some gut work as well, that you could clear up mental symptoms.
Yeah, now you mentioned mood. Is it also something that we see with like kind of that fogginess, that mental fog?
Yeah.
Okay.
Yeah. So, again, going back to this case, she says, I feel so befuddled, I can't get anything, I can't even do anything.
Yeah.
And that's oftentimes what people say. They don't come in and say, I have brain fog usually. They say, I can't accomplish things. I feel like I just can't think,
Right, yeah. So is this similar to like the histamine intolerance? Is that the same category of condition here?
It's like a portion of it.
Okay.
So I like to think of histamine intolerance. Sure, people can actually have just histamine intolerance. Maybe it's because of DAO enzyme deficiency, or maybe N-methylhistamine, histamine N-methyltransferase deficiency. But you have to be careful to look at all of these various symptoms and different systems, and almost any condition that you can think of that could have mast cells. And you have to make sure it's not that, because otherwise you can be looking at the tip of the iceberg.
Yeah, okay, that makes sense.
Part of it, but not the whole thing. You're not looking below the water.
Okay.
Yeah.
So let's shift and dive into where it all begins, the gut.
Yeah.
Right?
Yeah.
We love the gut.
The gut.
And
the gut is
medicine.
everything.
So talk a little bit about the role of the gut for this group of patients, and also what are the aspects of digestion and gut health that you really focus in on when you're evaluating patients who are experiencing this kind of mast cell activation?
Yeah, so the gut, the gut is the entry port, and it's got so much of the immune system, so it's charged with, that I call that the army. And it's just gut conditions, overgrowth, and lack of motility are just so rampant. So I almost always inevitably end up doing a bacterial overgrowth workup with either a stool test, comprehensive stool testing, or a lot of times a breath test, because people oftentimes, a lot of times the way it happens in my clinic is they come in for gut symptoms, and then, oh, by the way, oh, your face is kind of red. Do you have flushing? And they admit that they do, or hives.
Right.
A lot of times people have those. But so I think, the gut is an entire ecosystem of its own, and mast cells live there. So you have to be just looking at all aspects of overgrowth and motility. So it's very frequent that I work on motility, using various things, and then I'll work on overgrowth depending on whatever testing comes back.
Okay, so let's start with motility. What are the things that, because absolutely this is a huge challenge for a ton of patients. They're not going to the bathroom regularly.
Right.
So you're talking about constipation, essentially. When you talk about motility, and there can be so much involved in that, from dietary factors is what we all think of. And I think in the conventional world, they're like, just take more fiber and drink more water. But a lot of patients have tried that when they come in.
Miralax.
Yeah. It's like they have a Miralax deficiency.
That's right. Everybody has a Miralax deficiency.
That's right. But there's so much more to like colon motility beyond just fiber and water.
Yeah.
What are the other things that you do when patients come in and they've already tried that? They've already covered those bases. What are you using successfully for motility?
I usually use, supplement-wise, I try a combination of ginger products. So it may be just ginger, or they may like to eat ginger or drink ginger tea. Ginger or MotoPro, which has ginger in it as well. One thing I particularly pay attention to is, and this doesn't have to be with all patients, but I like to pay attention to mitochondrial efficiency. So, because motility is an energy process in part. It's partly a nervous message process, but it's partly a energy process. So sometimes I find that using mitochondrial support is useful. Curiously, if somebody has allergies and they're coming in and they're taking long-acting allergy medicines, for instance, those people I find can have constipation.
Okay.
Because it's so drying.
Yeah, that makes sense.
Yeah.
Okay, so talking about allergies, another area of gut health that's really important is the microbiome. And you've mentioned you do testing to really determine, I think it sounds like both pathogenic species and maybe beneficial species that are out of whack, out of balance.
Right.
Talk a little bit more about that. Like, why is the microbiome so important for good immune balance and for having, mast cell function be normalized?
I think that, you have to have the right balance, because we know now that the microbiome influences so many things. It creates folate for us and various different nutrients. It has an interaction with creating energy for us with the mitochondria. It produces small chain fatty acids. This is the number one thing probably that I see. Low populations of certain things probably being crowded by other populations that are too high, and then a lack of butyrate. So it's interesting, the good old small chain fatty acid butyrate is also a mast cell stabilizer. It's interesting. So if you get this kind of evolution into deficient bacteria in that way, low butyrate, then you have increased permeability problems.
Yeah, and that connection is really interesting, because it kind of shows the fact that, having healthy microbiota, which produce butyrate, without that, you could be predisposed to more allergic symptoms.
It's interesting when you look at, just going back to the mast cells, the tryptase that I talked about and chymase are two different enzymes, directly promote increased gut permeability, so you could see how butyrate is potentially so powerful.
Yeah, and it sounds like without it, you can kind of get this escalating cycle of a problem where you get more leaky gut, and then you get more triggers entering the body.
Right, exactly.
Which cause more gut disruption.
Exactly.
And it's a vicious cycle.
Right.
Yeah,
and furthermore, they can go anywhere, including to the brain,
right,
where they activate the microglia. They can go to the nervous system, to the vagus. So a lot of times you see this vagal disbalance.
Which then affects motility too.
Exactly.
It gets complicated.
It does. And then you have somebody who's come in, they had a back injury, they were in a car accident. So now you have the celiac plexus involved.
Yeah. People don't come in with simple conditions
anymore.
No, they don't. That's for sure. So it sounds like for these patients, the plans that you build for them must be really comprehensive in order for them to be successful, because they're each going to have unique triggers that need to be addressed, whether it's environmental, it's food, things that are very specific and unique to them. After you've addressed those foundational pieces, are there supplements that you add to their plan that you've found to be helpful to really help to get their kind of allergic symptoms to get into a better balance for them?
There's several areas. So there's the area of supplements that might directly improve histamine clearance or mast cell stability. So for mast cell stability, I like to use quercetin a lot. It's important when you're dealing with supplements to use supplements that have as few incipients as possible, because those can be triggers. So quercetin is a biggie. Sometimes I like to use DAO enzyme. It's important to have good methylation, because that's important in that histamine enzyme, histamine N-methyltransferase.
Okay.
So particularly SAMe and betaine, trimethylglycine.
Yeah.
So a lot of times it's useful to have a multivitamin that has a nice complement of activated B vitamins, maybe adding some TMG. There aren't that many things directly that are helpful to reduce mast cell activity. Sometimes you can add curcumin, but I usually don't do that with everybody.
Okay.
Quercetin and DAO are common. One of the things that's important is to use a supplement regimen for clearing dysbiosis.
Are you using like botanicals that are targeted at, overgrowth of specific, it could be fungal, bacterial?
Yeah.
Okay.
I like to use non-combo products, at least initially, because I don't know what is going to be a trigger for a person.
Okay.
And if you give a combo, I don't know which thing they're reacting to.
That makes sense.
My favorites are the usual, berberine, neem, allicin, oregano oil.
And then do you support production of healthy microbiome as well through a probiotic that you might supplement?
Yeah, so this is actually a really interesting topic, because people with mast cell overactivation or allergies oftentimes don't tolerate probiotics.
Yeah, I was
really
going to ask
well.
about that. I've seen that too.
Or fermented foods. I had a horrible time with this. I would go to conferences and they would talk about giving probiotics to everybody. And I was like that person that stood up in the conference and said, please don't tell everybody to do that. And people with SIBO, you can see that as well.
I see it in Crohn's too, like patients with Crohn's that they, their microbiome needs restoration, but until the gut lining is addressed and until they actually could get a flare rather than feel better on a probiotic.
Right, and so one of the thing is many of the common probiotics, a lot of the lactobacillus, the same ones that are in fermented foods, tend to be histamine producing. So I tend to first do nothing with probiotics until I get a feel. And maybe get some mast cell stabilizers in. And then I like to start adding some probiotics that are either histamine degrading or neutral. So there's some of the lactobacillus and there's the bifidobacters. So a lot of times I like to start with B. infantis because it's usually well tolerated and it doesn't produce histamines. I like to use the spore-based probiotics and sometimes Saccharomyces. Sometimes later on in the course, you like to feed the good bacteria because, of course, what we take in probiotics is just such a small portion of the bacteria that we need. So you have to try to feed them. So using resistant starches and such.
What are your favorites to use? Are you using inulin, or like what are your favorite kind of prebiotic fibers that you recommend?
A lot of times I have them try to eat their prebiotic fibers.
Yeah, that's the best way.
I think in that case it is.
Get your Jerusalem artichokes in.
That's right.
Those are the most
your
delicious.
jicama.
I love them. It's a fun reason to expose people to new foods.
Yeah, I'm always telling people, although this is touchy because technically speaking bananas are histamine producers, but get some plantain, put a little bit of it in a shake,
I didn't know plantain was a good source of
probiotics.
probiotics.
Yeah, as long as you don't cook it.
Oh, that's good. Good to know. Great. Yeah. Great. Well, any other tips or tricks you'd give to clinicians? I think this sounds like an area where, if clinicians are seeing a lot of allergic patients, it's really, what I've learned out of today is you have to look a little bit deeper.
Yes.
And it's not as simple as, giving a Benadryl or giving a quercetin. There's obviously, I always think about what are the underlying factors that contribute, and I do think about food allergies and things like that, but the story is actually much bigger than that. I've really learned that from you today. So taking that multifactorial approach is going to be really essential. Are there any other kind of closing tips you'd give to clinicians who maybe think they're treating allergies, or they have patients that they've been trying to treat allergies and things aren't working, and they watch this and realize maybe they know why now? Any other kind of final closing tips?
Yeah, I think just the tip is you have to be curious and look broader. Even things that, the classic of this that we've learned from the leaders that have been doing this as experts for many years and see complicated cases is that you just, almost anything you look at, if you have a patient coming in with many seemingly unconnected things and they're oftentimes odd presentations in the presence of some sort of allergic or inflammatory thing, you just really have to dig, and you may have to do some learning. You may have to get on the computer and start typing in mast cells and whatever and see what you come up with.
Well, thank you. I've learned a lot.
Thank you.